How does dehydration arise in a nursing home?
In nursing homes, residents can be susceptible to dehydration. What we would be looking at are residents that have infections that might lead to dehydration. Some residents are known to have poor food or fluid intake that can obviously lead to dehydration. Some of them are suffering from vomiting or diarrhea. Others are taking medications that might make them susceptible to dehydration, or a combination of all of these factors.
What do you look at in assessing if dehydration is a result of negligence?
When people call us to see if there's a case against a nursing home because their loved one became dehydrated, what we have to look at are the steps that a nursing home is supposed to take in the care process. So the first thing that a nursing home is supposed to do is assess the patient. They do this on admission to the nursing home, and then they're supposed to do this periodically throughout the stay. One of the things that they're supposed to assess for is dehydration risk. What they're looking for are the very things that I just talked about earlier. Then they have to plan for that risk, and that involves implementing a care plan for that particular resident to make sure that they are monitoring their food and fluid intake, monitoring their medications, following their doctor's orders, sometimes making sure that physicians have more frequent contact with the resident, and constantly assessing, looking at the signs. Well, I've now moved from planning into assessing. So while the patient or the resident is in the nursing home, after they've planned for the care, they have to assess the resident on a daily basis. The nurses should be looking at the resident to look for signs of dehydration. What are the signs of dehydration? Dry mouth, cracked lips, lower blood pressure, confusion. They're supposed to be looking at the charts to see if the food intake has dropped. Have they been refusing liquids? These are the things that they should be looking for. What I do when I'm assessing a dehydration case is look at the entire sequence of events. Did they fail to assess the resident? Did they assess the resident, assess them as a dehydration risk, and then fail to implement a plan, or did they fail to assess properly before they implemented a plan? One of the things I look for is how bad did the dehydration get? In some cases we've seen that they end up in the hospital with full-blown kidney failure. There's really no excuse for this. When this happens, in my mind, it's almost always the result of negligence. If you believe that you have a potential case involving dehydration in the nursing home caused by negligence, please give us a call, 740-374-5346, or visit our website, www.fieldsdemlo.com.